Every day, 10,000 Americans turn 65, qualifying for Medicare. In our service area of Western Wayne County and Downriver, 23% of the population is age 60 or older. 1 in 4 people age 45 to 64 are caregivers. They divide time between raising a family, their work lives, and caring for their parents. Any services, programs, or devices to help them with caregiving tasks improves the quality of life for everyone involved. One of our core values is innovation. We embrace innovation is crucial to navigating the changing landscape of what it is to age in America. Many of our innovative programs, products, and initiatives aim at fulfilling our mission, assisting people to thrive as they live, age, and grow.
So the medication dispenser, the participant can put their meds in, a family member can do it, or a nurse can come and do it. And so then their medications are, they get a notification when it's time to take their meds, so they're taking the proper dose at the proper time.
So the MyID bracelet is a new form of the medical alert bracelet that has a QR code on the back of it now instead of just the name of your disease or your ailment.
I think it's a wonderful tool or an extension of helping the residents across Michigan, across the country.
If you were found lost on the street or in a medical emergency, somebody would be able to scan it with a phone and the information would pop up.
This ID will get the resident or the person that's lost back to their family member and back home.
Companion pets are robotic animals that are lifelike, and the dog likes to bark and will wag his tail and turn and look at you when you're talking to him. And there also is a robotic cat as well that does similar, except for the cat purrs, meows, and moves its paws.
When we provide a companion pet, you get a really amazing response. And that's really heartwarming to hear, like, thank you so much. You know what I mean? I love it. You'll hear cute stories, and it's just, it's something positive that you hear. So it feels good to be able to, connect them with it.
Rosy Reminder is a digital clock that plugs in that you do not need the internet for, which is an advantage for some of the older adults who don't have internet access. And one of our coworkers created a very easy cheat sheet to use to set reminders such as when to take your pills, perhaps to get reminders to eat, activities of daily living, birthday reminders for family members. But it could also be a friendly reminder of, hey, I'm thinking of you today. I love you, Mom. Have a good night, Dad.
For the first time, the Senior Alliance has created a new role of a database curator in order to maintain, evolve, and expand the online resource directory. The Senior Alliance has information and assistance specialists who use the online resource directory to connect older adults, those living with disabilities, their families, and caregivers to services in their area. The online resource directory is available on the Senior Alliance's website, also making it super easy to share. And simply put, the more people we're able to reach, the more people we can help.
Harken is a program at the Senior Alliance that helps to address social isolation, loneliness, and unaddressed mental health in older adults.
So the core of the program is the Wellness Recovery Action Plan, and that is where they list their interests, their needs, and specifically their goals for the program as it relates to socialization and their mental health. One of the things we created to help them with that is the Harken Planner. And so this is something that they can hold on to. It'll keep them more focused, less stressed, more organized, and most importantly, help them get closer to reaching their goals in the program.
So the Direct Care Worker Needs Fund, also called the DCW Needs Fund, this is a fund that was created back in January of 2023. And the reason that we created it was to help reduce or eliminate hardships that caregivers are facing on a daily basis.
We learned of the Direct Care Needs Fund last year. Our home care aide called our office to inform us that she was juggling between having enough gas to take her children to school and seeing her clients that week. And she reached out to them immediately asking for help. We heard back the same day with the approval that they were going to approve $150 of gas cards for our worker. We immediately were able to distribute those gas cards to her. She was able to take both her children to school that week and see her clients.
The Michigan Medicare Assistance Program counselors are a dedicated team who are certified and trained in health benefits counseling. We're seeing more first-time clients than we've seen in the past with this method, and as a result, seeing significant savings in prescription drug costs and other benefits. We know our community model is working because we have been able to save Medicare beneficiaries over $1 million this year alone. Our staff are able to answer questions in person and provide resources right on the spot.
Our community is so large here in Dearborn. We have the largest concentration of Arab Americans in the country. And we started with about 10, 15 meals a day, and now I believe it's close to 100 meals a day. And then we said, why don't we do a congregate meal too for those who are able? And my goal is to get the active seniors stay active. There are the ones that are really, really craving for social relationships and being together and seeing people that look like them and breaking bread and eating with them. So I feel that this program would bring people together. And to see them get along and socialize together and exchange phone numbers and recipes and ideas and engage really, really touches my heart.
It's probably more rewarding for me than what I'm doing for the seniors because I know I'm impacting them and I'm impacting their life and I'm providing them with a service that is very needed in this community, and especially for someone who's isolated, limited support, language barrier. They don't have any other means of getting the food.
At the end of the day, I feel very happy to serve all the seniors, and it means to me a lot.
We're doing something good for them because God knows if those people eat or not. God knows they could make their own lunches or not, but we're more than happy to give the lunch to them. We're more than happy to see them eat and be in good health.
So Inside the Senior Alliance is a podcast that explores issues in the field of aging. It started out originally as a way for us to talk about the resources that we have available as an area agency on aging. So it's evolved over time from something to be about resources into something bigger, incorporating advocacy and the much bigger picture.
The biggest benefit of the podcast is just a new and innovative way to find information regarding aging. I think that there are a lot of different age groups that aging affects, and a podcast is a new way to reach people like myself who are young adults. You can find our podcast on our website, www.thesenioralliance.org, or on Apple, Spotify, or any platform that you listen to podcasts on.